Anemia. In this video, let's see definition, classification, and about RBC indices. Anemia. Anemia is defined as reduced hemoglobin concentration in the blood below the lower limit of normal range for the age and sex and altitude of the residence of an individual. Normal values in men is 13 to 17 grams per deciliters. In females, it is 12 to 15 grams per deciliters. Classification. It is a morphological classification, etiological classification. Morphological classification: normocytic, normochromic, microcytic, hypochromic, and macrocytic. Microcytic hypochromic is 4 CETA. Sideroblastic anemia, iron deficiency anemia, thalassemia, anemia of chronic disease. Now let's come into etiological classification. It might be due to blood loss, impaired red cell production, increased red cell destruction. Under etiological classification, it is blood loss, impaired red cell production, and increased red cell destruction. Under blood loss, it is acute and chronic. Acute is large amount of blood loss in a short period of time. It is seen in trauma and postpartum bleeding. Chronic is small amount of blood loss for a long period of time. Peptic ulcer disease, hemorrhoids, carcinoma of colon, hookworm infections, any. And excessive menstrual blood loss. Impaired red cell production. It is seen in defective DNA synthesis. Defective DNA synthesis, megaloblastic anemia. Megaloblastic anemia due to vitamin B12 deficiency, B9 deficiency, there is decreased DNA synthesis, and in renal failure due to deficiency of erythropoietin. And anemia of chronic diseases. Any chronic diseases. Anemia of endocrine disorders. Defective hemoglobin synthesis, defective heme and globulin. Heme synthesis is seen in iron deficiency anemia and sideroblastic anemia. Globulin synthesis deficiency is seen in thalassemia. It is in primary hematopoietic neoplasms, marrow replacement, metastatic neoplasms, and disturbed proliferation and differentiation of stem cells is seen in aplastic anemia. And increased red cell destruction. It is one is intracorpuscular type of red cell destruction and extracorpuscular type of red cell destruction, that is extrinsic. Intracorpuscular red cell destruction, that is intrinsic, is of two types, hereditary and acquired. Hereditary, there are abnormal membrane seen in spherocytosis and elliptocytosis. And enzyme deficiencies like G6PD deficiency, pyruvate kinase deficiency, hemoglobin synthesis deficiency like thalassemia, it is seen in thalassemia. And acquired membrane defects, paroxysmal nocturnal hemoglobinuria. Under extrinsic, it is antibody mediated, mechanical loss to RBCs, and any infections. Antibody mediated isohemagglutinins and autoantibodies. Isohemagglutinins is seen in transfusion reaction and RH disorders of newborn, disease of newborn. Autoantibodies diseases like systemic lupus erythematosus, drug-induced and idiopathic. Mechanical trauma to RBCs, microangiopathic hemolytic anemia due to DIC. Infections due to malaria. Done. Thank you. RBC indices. There are 5 types of RBC indices. MCV, mean corpuscular volume. MCH, mean corpuscular hemoglobin. Mean corpuscular hemoglobin concentration, MCHC. Red cell distribution with RDW. And Menzer's index. Mean corpuscular volume, it is average volume of RBC or average size of an RBC. Normal values are 80 to 100. If any value less than 80, it is microcytic. Greater than 100, it is macrocytic. Mean corpuscular hemoglobin, average amount of hemoglobin in a single RBC. Normal values is 27 to 32 picograms. Less than 27 is hypochromic. Greater than 32 is hyperchromic. MCHC, average hemoglobin in a given volume of packed cell volume. It is MCH by MCV. Normal values ranges from 32 to 37 grams per deciliters. Yeah. Red cell width, it is nothing but variation of red cell size. Also degree of, nothing but degree of anisocytosis. Normal range is from 11.5, 14.5 percentages of change in the shape of the RBCs is acceptable. RDW is increased in iron deficiency anemia. It is normal in thalassemia. Yeah. Menzer index is nothing but MCV by RBC. Normal value is 13. Less than 13 is thalassemia and greater than 13 is iron deficiency anemia. Done.